Welcome to our presentation on the primary care nurse practitioner. We hope that you enjoy the presentation and learn something new. To learn more about the primary care nurse practitioner, it is important to look back at the evolution of the role. The nurse practitioner role formed partially as a result of Medicaid and Medicare expansion in 1965. During this time, coverage was expanded to low-income women, children, and disabled adults, therefore increasing the demand for primary care providers. The first nurse practitioner program was developed in 1965 at the University of Colorado by Dr. Loretta Ford and Dr. Henry Silver. This was a pediatric nurse practitioner program that consisted of a 4-month training, not a master's level preparation. A few years later, in 1968, the second nurse practitioner program developed at Boston College. By 1973, more than 65 nurse practitioner programs had been established. As of August 2019, according to the American Association of Nurse Practitioners, there are now more than 270,000 licensed nurse practitioners in the United States. Of those, almost 73%, around 197,000, currently deliver primary care. With the expanded healthcare coverage brought on by the Affordable Care Act, more nurse practitioners were needed to provide primary care. Requirements to practice as an advanced nurse practitioner include having a current registered nurse license, have completed a master's or doctorate program, completed 500 to 700 clinical hours, and passed a certification exam given by either the American Association of Nurse Practitioners or the American Nurse Credentialing Center. Primary care nurse practitioners are most often found in the clinic setting, whether it be a hospital-based outpatient clinic, hospital group practice clinic, or a private physician clinic. However, there is a growing trend of primary care nurse practitioners practicing in more rural areas and underserved community health centers. Tracy and O'Grady write about nurse-led centers also being a place where primary care nurse practitioners are practicing. Although not seen very frequently, these nurse-led centers can make huge strides in bringing the high-quality, multidisciplinary care to places that normally lack this type of access. And then, as of 2017, advanced practice registered nurses, not including CRNAs, were granted full practice authority in the Veterans Affairs system. So now, more primary care nurse practitioners are being utilized to their full potential. The primary care nurse practitioner scope of practice follows the general scope of practice for nurse practitioners, but does vary by state. As you can see, the main elements of our scope of practice include assessing, diagnosing, and managing patients' care. Iowa is one of only 22 states that allow independent practice by nurse practitioners. Other states either reduce or restrict at least one element of practice. The primary care nurse practitioner's competencies encompass both the advanced practice nurse practitioner 7 competencies, as listed here, and the National Organization of Nurse Practitioner Faculty's core competencies. We will show you how they complement each other on the following slides. Direct clinical practice is the main competency for primary care nurse practitioners, as direct patient care is what we do most. All 3 of these competencies speak to primary care nurse practitioners taking a holistic approach to their patients by treating the body and mind. In addition, primary care nurse practitioners provide care that is patient-centered, where they develop relationships upon mutual respect, all while translating research into their advanced practice. Secondly, primary care nurse practitioners are required to carry competencies in guidance and coaching in order to assist patients through different life transitions. Primary care nurse practitioners can do that by coordinating transitional services and by incorporating appropriate technological features into their patients' care. Because the patient population continues to increase in their complex medical conditions, primary care nurse practitioners need to be competent in the area of consultation. Primary care nurse practitioners need to understand the importance of networking with a wide range of disciplines in order to improve patient outcomes and enhance own knowledge. Next, effective collaboration is also important in providing well-rounded patient care. Collaborating with colleagues, caregivers, and patients allow for cumulative decision-making. Utilizing evidence-based research, theories, and practice is vital for primary care nurse practitioners. When your patients come to see you, they can put their mind at ease knowing you have investigated and implemented evidence-based therapies to help them improve their outcomes. Leadership, in addition to collaboration, will allow primary care nurse practitioners to shape the future of the care we provide. Being able to effectively lead and manage change is an important competency not only to our patients' health, but for the primary care nurse practitioner's environment as well. Primary care nurse practitioners will no doubt be faced with difficult decisions throughout their careers. Whether the decision be about a patient outcome or allocation of care, primary care nurse practitioners must always be ethically aware of their actions. When ethical decisions need to be made in regards to patient care, primary care nurse practitioners need to take consideration for complex cultural diversity. And when financial decisions are made, primary care nurse practitioners will need to evaluate the potential ethical consequences of their decisions. Due to the politics that surround the advanced practice nurse, there are some challenges that primary care nurse practitioners will have to overcome. One we want to touch on is how some physicians view our role. For various reasons, there has been confusion and disagreement between physicians and nurse practitioners on what can and cannot be done by a nurse practitioner. Many physicians do not feel that nurse practitioners should be given the same independence and responsibilities because they put more time into their education. Despite physicians fighting to diminish nurse practitioners' autonomy, it has been found that nurse practitioners can provide the same level of care as physicians. As nurse practitioners take over the primary care field and trickle into specialty areas, there is increased animosity between nurse practitioners and certain physicians, especially old school physicians. Secondly is the ceiling of reimbursement. We found that Medicare reimburses nurse practitioners at a rate of 85% of what they pay a physician, even if they perform the same task and deliver the same outcome. This goes back to the discrepancy of the perceived value of the nurse practitioner versus the physician. We are hopeful that in the near future this will be changed, and our reimbursement will match that of a physician at 100%. Lastly, as mentioned in an earlier slide, our scope of practice is reduced or restricted in almost 30 states. All advanced practice registered nurses, including the primary care nurse practitioner, will need to continue to write their legislature and encourage their states to allow full practice authority. In the meantime, primary care nurse practitioners in those reduced or restricted states need to continue proving themselves as quality providers. The future is bright for primary care nurse practitioners. According to the Bureau of Labor and Statistics, by 2020, the demand for nurse practitioners is said to increase by 30%. This is partly due to the aging population and because of the increased number of insured patients from the Affordable Care Act. Many medical students are choosing to specialize rather than pursue a career in family medicine, which means even higher demand for primary care nurse practitioners. The Affordable Care Act supports the use of nurse practitioners in primary care, and it supports the idea that nurse practitioners can provide the same standards of care as physicians. In addition, Tracy and O'Grady write that there is a possibility of postgraduate nurse practitioner residencies to make headway. There are already some residency programs out there, and studies have shown positive feedback. One more concept that is becoming more and more familiar is that of telecare or telehealth. The use of remote technology to bring healthcare to patients is a neat opportunity for primary care nurse practitioners. This allows us to share their knowledge and patient-centered care to more rural or underserved populations. Throughout this presentation, we talked about the background, current nature, and the future of the primary care nurse practitioner. According to statistics, the majority of us will become primary care nurse practitioners. The opportunities to better serve our communities are endless. By constantly researching and implementing evidence-based practice and new technology, primary care nurse practitioners are going to improve the lives of many people. Most importantly, find something you love to do and you will never work a day in your life. Thank you for listening.